You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, health reform advocate, Dr. Tony Leachon. Dr. Leachon, welcome to The Source. Good to see you too.
Good morning, Pinky, and good morning to your televiewers. Magandang umaga po.
Let's talk about monkeypox. I was researching about this last night, and it is recorded in about 14 countries with over 80 cases. Maybe, of course, this number will be moving as the days and hours go by. Can you tell us more about monkeypox?
Well, monkeypox is a disease which has been reappearing right now. It belongs to the family of the smallpox. It was first discovered in 1958 and then recurred in 2017. While smallpox, the last case was in 1977, and this was declared as controlled in 1980 because of the power of the vaccines. Monkeypox is I would say, a rare disease that would present with fever, cough, and sore throat and body malaise, but will be followed by a skin rash that will be appearing as macules or papules or blisters with lymph nodes, may mga kulani sa leeg, in the axilla as well as the inguinal nodes. And this will actually be lasting for 2 to 3 weeks and self-limiting. Based on the WHO and the CDC, may relation in terms of its contact with respiratory droplets or contacts with the skin lesions, or men having sex with men, as found in Madrid, in some sex health clinics there. So yan ang transmission, and ang transmission is right now in Europe, Canada, and of course US, and then Australia. Walang local transmission here. It's a serious outbreak of a serious illness, but we should not panic. I think we're going to be able to control this.
But is there any concern on why it has re-emerged?
Well, I think based on the report of this CDC and WHO, because of the liberality of travel, and of course when they opened the borders, of course, nagkaroon ng travel, nagkaroon ng pagkalat din. This particular disease kasi came from West Africa and Central Africa. So sa pag-travel, kasama na rin ito. That's why pumupunta sa other areas. And of course, the change in the lifestyle, yung hygienic measures natin, nagbago. And of course, the invasion of the habitat ng animals. For example, it is found sa mga exotic animals, first rodents, and then ngayon sa primates or monkeys. I think these are the 3 reasons put forward why bigla nag-reappear siya. So dati, nandun lang siya sa Africa, but because of the liberality or perhaps the travel, nakapunta siya in other areas.
Yeah, but if you were telling me that it last emerged decades ago, and we were possibly locked down for about 2 years, why did it emerge now? We have been traveling even prior to the pandemic in Huba, and there was no monkeypox. But why now?
The last, I think, based on the CDC, was in 2017 in Nigeria. Merong mga cases doon, pero it's contained in that particular area. Kaya lang because of the travel, which is actually more extensive right now, plus of course reduction of the immune system then because of the COVID sa tingin ko, plus the other practices na nakikita natin ngayon in terms of hygienic measures. Ito nga bagong report na it may actually appear men having sex with men in persons with this kind of condition or bisexual or gay relationship nagkakaroon. So ang diseases kasi usually unpredictable katulad ng other viral illnesses. And we really don't know. Like ang COVID, 20 years ago, andyan siya, SARS-1. And then nagkaroon ka ng MERS-CoV, and then suddenly, nag-reappear siya. So, I really don't know kung bakit niya nag-reappear, but those are the reasons put forward, reports, coming from WHO and the CDC, and some reports coming from some academic institutions.
I also read that it was, please correct me if I'm wrong, it was supposed to be endemic in, if not West Central Africa. But now it has actually re-emerged in countries that did not have it. So would that be concerning?
That's concerning for the WHO. In fact, last Friday, they met whether this could be judged as a public health of international concern, because it has spread in areas uh, not usually the usual source or endemic to that particular area. And based, of course, in literature, makikita lang natin sa West and Central Africa. We have the Congo strain and the West African strain. But right now, it's in areas na hindi natin makikita. They're trying to trace kung ito ba ay related nga dun sa contact sa gay and bisexual. But I don't want to stigmatize this, because as this has been reported by a Twitter by Dr. Eric Fielding from Harvard, and they're still finding out the connections. But the usual presentation is, of course, the physical contact and the respiratory droplets and the break in the skin. The appearance in gay and bisexual, or men having sex with men, is actually new, and this is based on the WHO and the CDC reports. So I think maybe because of the cavalier as well as the lifestyle practices right now of many people, nagkakaroon ng ganito, Pinky. And the reports are still unveiling, ang data pumapasok sa atin. Ang maganda lang, we have a vaccine, the smallpox, which will be 85% effective just in case, and hindi na natin siya i-discover. Merong another vaccine based on the CDC, the INEOS, which may be actually be effective as well. So ako, hindi masyado ako nagpapanik lang, but we should put our countrymen, our fellow Filipinos, on the alert just in case it would actually enter our country.
So there's a vaccine for the smallpox. Again, let's talk about if this will be effective, if it's going to be the same vaccine or it needs to be altered for the monkeypox. But we need to take a very short break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our source today, health reform advocate Dr. Tony Leachon. Dr. Leachon, let's talk about that vaccine. So there was or is a vaccine for smallpox. Tama ho ba yun? And can this be used for monkeypox?
Yes, according to the reports, in patients who are exposed to this, pwede mag-gamitin siya 4 days after the exposure, and you can prevent as well as lighten up the symptoms. No, ang smallpox vaccine may be an old one, but still be effective in 85% of cases. There are two new ones: the ACAM 200 and the Genius JYNNEOS, according to the FDA, according to the CDC. And this is the reason why the CDC and as well as President Joe Biden has alerted the people, because if this would actually be escalating in America, then of course we will be ready with the vaccines for that. But I'm happy that the smallpox vaccine, hindi katulad before nung sa COVID, we were scrambling right at that time to produce a vaccine. Ito meron tayo just in case it would escalate. So ang importante lang is that we put people on the alert, and the pharmaceutical companies and the CDC and the FDA and WHO will produce the vaccine just in case it would escalate. And meron din tayo in the horizon na available for commercial use.
Pag-usapan po natin practical situations. For example, Dr. Tony, meron pong isang tao sa bahay po natin na sabihin lang natin meron pong monkeypox. Would that be dangerous for the rest of those living in the house na mai-infect po sila? Are there ways to prevent this?
Okay, very good question. Una niyan is of course kaya at the borders natin, though hindi natin nila-lockdown ng borders, there's no reason to lockdown. But monitoring and surveillance lang ng symptoms kung meron siya or may skin rashes. Just in case nakalampas siya at nasa bahay siya, ang first thing to do is of course to isolate that particular individual and observe for 2 to 3 weeks and then report that to the Department of Health, of course, for surveillance monitoring and then of course for additional testing. But that particular person, until magkaroon ng clearing of the scabs or maging tuyo na, doon lang siya magiging non-infectious and it's self-limiting. And then perhaps with God's grace, sana magkaroon siya ng again immunity for that, just like in the smallpox before, or even with the chickenpox, except that with the chickenpox, nagkakaroon ka ng herpes zoster or shingles. So the right approach is to report to the Department of Health, isolate that particular individual right away, and do all these hygienic measures, wearing of the face mask, hand washing, yun ang pinaka-dapat gawin.
Meron po akong nabasa, I'm not sure if this is accurate. What about bed sheets? Can somebody actually get infected sa isang tao na gumamit ng bed sheet na meron po monkeypox?
Yes, bed sheets, towels can also be modes of transmission. Also sexual intercourse, na-report nga yan in sexual networks in Madrid, doon una nakita. So yan ang mga dapat tingnan. So respiratory droplets, physical contacts with the skin, towels, beddings and all, and of course sexual intercourse. Kasi may mga reported cases right now in Europe, like in a spa or sexual or health clinics. So yan ang mga areas na dapat nating tingnan. Ang airborne hindi pa conclusive para magsabi tayo kasi dapat close contact tayo dito. At tinitingnan din natin. Anyway, the same measure that would apply for COVID in terms of hygienic measures will be the same, of course, for the monkeypox din as well.
But this kind of condition, this can be easily detected, hindi ho ba? I mean, when do the pox actually surface sa katawan? When does it come out?
Usually on the, I would say on based of course on the, well, di pa naman tayo nagkaroon ng history in smallpox, but ako ng chickenpox. Usually you have 3 or 4 days of your fever, cough, and then dun lalabas ang rash mo. At ang rash ito will start from the face and then chest and then back. So chickenpox from the chest outward ang paglabas. So basically meron siyang prodrome, pinky. Meron kang incubation period na 5 to 21 days. So therefore, yung skin rash will appear siguro 4th to 5th day after your febrile episode and your flu-like manifestations.
And again, just as a last note, it's not yet detected here. There's still no case here in the country. And I guess as a last question, Dr. Leachon, what should government do in order to prevent this from appearing for anyone to have a case of the monkeypox in terms of border control?
I think the most important is to educate the people, and the best way is through the Department of Health infographic messaging for social media, and then alert the borders officers like the immigration, the Bureau of Quarantine, the port area and all. I think there should be a measure for us to monitor the symptoms coming from those places with monkeypox, and then reestablish again the isolation quarantine facilities just in case fever would patients would present with fever episodes and then skin rash, para sa ganun mas mabilis natin ma-isolate. I think that's the essence of this particular disease, no. Medyo mas maging maingat tayo kasi we will have our hands full kung ang COVID, there are variants right now entering the country, maybe 8.4, maybe 8.2.121, and we don't want to have this kind of problem appearing in our country, especially that the booster program is not yet as maximized katulad ng first booster natin at ng second booster natin.
Dr. Tony Leachon, sir, thank you so much for speaking to us.
Thank you very much, Pinky, and good morning.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.